Hi, I'm Chuck Wolfe, and you're listening to the Emotion Roadmap. Take the wheel and control how you feel. The show is broadcast on WPKN 89.5 FM on listener-supported radio in Bridgeport, Connecticut. It also is on YouTube, and it is when it is aired and recorded, it's put on YouTube. And when I have certain guests where I have thought leaders come in and I speak to them, as opposed to the call-in show where people call in and ask questions about challenging situations in their life, where I introduce them to the emotion roadmap I created over the years and help them to try and solve those challenges. Sometimes I find occasionally a thought leader who has some really important information, I think, about how we all deal with life and how we experience certain emotions around several challenging items that many of us are going to face. And one of those items is caregiving. At times, we face the idea that someone in our life that's really important to us needs a lot of care. And while we're busy with our own lives in many different ways, can be a parent, this can be a child, this can be a friend, a relative, anyone we're close to. And all of a sudden, we're asked to take on a different role, a supportive role. And we're wondering, how do we do that? What's the best way to do that? Or we might be the person in the situation who is diagnosed with a terrible illness and all of a sudden starts to lose our ability. And if, as a parent, I know many of the listeners to the show are elderly and that they experience a loss of their own abilities and they become more dependent, and that's challenging. So, caregiving can be the person who is the caregiver, and it can also be the person who needs the care, and a multitude of others who may be supportive at different times. And then, how do you divide the roles between siblings? Somebody lives close, somebody else doesn't. How do you help? How do you really take care of all the challenges involved with caregiving? Well, it's a really complex topic, and I happen to be at a center for a particular disease that my wife has, and it's something that is not debilitating, but could be at some point. And I heard a speaker, and that's Joan Monin, and she is turns out a Yale faculty member, and she was coming in to talk about the role in part of emotions in caregiving. And as many of you who listen to the show know, I've done a lot of work with some of the people at Yale on emotional intelligence, and I was intrigued and talked with Joan afterwards and found that we have some things in common, and perhaps the roadmap might be helpful in some of the work that she's doing. But she's got a lot of her own ideas that she's worked with, explored, researched, and is going to talk about today with all of us. So I'm going to ask her to tell you a little bit about herself and her work, and then how she's kind of focused on the role of emotions. And then we have sort of an outline we're going to follow, which is going to be about defining what is caregiving, because it has multiple forms, some of the challenges involved, emotionally, how it impacts us, some things we might do emotionally. She's got a Whoop model she's excited about, she'll tell you about, and possibly a place for where the roadmap might interact with this other model and find a way to help with the emotional aspects associated with caregiving. So I'd like to introduce Joan. And Joan, if you don't mind, if you tell us a little bit about yourself and um, what you do, how you got involved with this, and your background, that'd be a great way to start.
Thanks so much, Chuck. It's a pleasure to be talking with you. I'm Joan Monin. I'm at Yale School of Public Health. I'm an associate professor in social and behavioral sciences. And for a long time, I've really been interested in how, um, just like caregiving and health are related across the lifespan. And I started off really being interested in spouses and what does it mean to be both someone who cares for someone else and also receives care over time and how that might change from person to person. And so that flexibility and potentially that mutuality of both being a caregiver and a care receiver. Because most of the time we think about caregiving as really a one-sided thing. There's someone who's giving care to someone else and they're receiving it, and those are defined roles. But when you think about real life, that's not actually how it always happens. If
Mhm.
you're looking at early adult or early childhood, you know, there is a clear role. Who is the caregiver and who is the child or the care recipient? And in some circumstances with abilities, if there's severe disability, really we know who the caregiver is and who the care recipient is. But practically speaking, in all of our relationships, these kind of blend together all the time. And so we don't really know exactly how to support people within like the medical model or healthcare. And sometimes we revert back to saying someone has an illness and whoever is their partner is the caregiver. But that might not even be the case. So what I'm really interested in my research is kind of understanding not only the caregiving role, but also how it actually plays out in everyday life in, partnerships or dyads, or even beyond the dyad, like in a family system where people are changing roles and there's intergenerational relationships. So, right now I'm really interested in adult children and their parents in the very early stages of dementia and how that kind of role shifts at that point for the child and the parent. But most of my work has actually been on spouses and how they, when one spouse has an illness or a disability in older adulthood, how that other spouse kind of adjusts and supports the person with the illness, and how the person with the illness kind of receives support too, and then also gives back to whoever is labeled as the caregiver.
Well, I think as people are listening, I'm listening to you, Joan. It seems to me that one of the things that runs through people's minds is everybody, I think, that has a loving relationship with someone else is wants to be supportive, wants to be helpful. Um, Often resilience is a problem in the sense that we all have our challenges. Everybody's busy. I know even with children that you're close to in your family, you want to see them, you'd like to be with them, but you or I have times when, geez, I haven't seen you in a while, but partly that's on me because I've been busy with my life, my personal things, and you've been busy with yours. Remember the song "The Cat's in the Cradle"? Hey, you want to get together, Dad? And people, and you don't seem to find the time, but and yet when things happen to people that you care about and you love and you want to help them, I think it starts off probably, sure, I'll help you. But then reality kicks in and it's hard to carve out time, it's hard to find time. And even when you're doing it well for a period of time, sometimes one sibling, for instance, will help with a parent who's aging and becoming more dependent, getting dementia, having some kind of illness that that causes them to need you to drive them somewhere, to do something for them, to take them to the doctor. Um, this I think the demands keep increasing and increasing, and it's hard sometimes for people to stay on track and not feel upset with other people in their family or friends who aren't doing more. So I think it's an emotional roller coaster for a lot of people that it's sometimes you figured it out and it feels like I'm really glad I can be helpful to you. And other times you're really on the low part of it where I don't know how I can do any more for you. How do you talk about or help people with or what have you found in research that helps people continue to be motivated, to continue to feel somewhat resilient, to find ways to pick themselves up, to let go of the jealousies or, the fact that you feel like you're doing more, somebody's not doing enough. There's so many emotions that complicate all of this. How do you find your way through that?
Yeah, I think what in talking a lot of family therapists around caregiving, they often say, when there's multiple potential caregivers in a family, that it's really about having those family meetings and understanding what skills each person brings to the table, right? So you sometimes have, one daughter who was like a CEO and really knows how to like call up and organize teams and things like that. And then you have another daughter that worked in healthcare as a nurse and is like really comfortable with helping with, activities of daily living that, a parent might need. And then you have another sibling that's maybe really good at kind of diffusing stress, is like really good at like emotionally caring for everybody in the family or like cooking or just being there to support the other people. And it's really important to think about maximizing the strengths that people have for that team, like asking someone to do something they're really not comfortable with. It's probably, sometimes it needs to be done, if there's not anyone else to do it. But if it's possible, that's usually the way people like to do it.
I think that's a great point that you're making about everybody doesn't have to do the same thing. I think if you can tap people for what they're really good at and they can contribute in the ways that their strengths come into play, it actually creates resilience for people, I think. So I do think there's a possibility at times that um, focusing on where are we all strong and having that conversation probably can offset perhaps some concerns that people might have otherwise.
Yes, I think there's also just practical and stressful things that need to get done that probably no one wants to do. And so usually someone, like takes one for the team, but it's important for the other people to kind of be a source of respite for that person too. So say there's one person that lives very close and has to do a lot more of the everyday things. And just having the other people step in when that person needs a break or needs to take over something for them is, I know, like personally from my family, that's really important for maybe the main caregiver in a family.
How did you find yourself getting involved with this particular topic and this area of research? Lots of things to pick from. Obviously, a very smart person. We go down multiple different pathways, and you ended up in this area, in this field. Was there something personal or just professionally? You just had an interest?
I think I've always been curious about how people kind of calm themselves in situations where someone's in pain or suffering that they really love, and how they're able to take their attention away from their self and how bad it feels to be near someone who's in pain and be able to take care of that person in a compassionate way. I think I've just maybe it's like telling something personal about myself, but I tend to be like if there's someone that I love is feeling really upset, I tend to get very anxious. And I've seen other people who are so good in this role that they're able to kind of just like be calm, collected, and just really focus on making sure that person is doing well. And I felt like that was a dynamic that I was really interested in. And so I actually did that for my dissertation when I was at Carnegie Mellon University, is reactions to people's anxiety expressions in romantic relationships and kind of what backgrounds kind of lend themselves to having these more compassionate responses versus these responses that are more like self-focused. Like I feel really uncomfortable or I'm angry at that person as a defense mechanism. And then I was really interested in that, but I also wanted to help people in some way. And I wasn't sure how that research was going to actually end up like helping people's lives. So I ended up talking to someone at University of Pittsburgh who told me about older adult caregiving research, which I didn't even know really existed at the time. Um, but the way that it was being studied was in epidemiology, and it was just comparing how long um, older adult caregivers lived compared to people who were older adults and not caregivers. And turns out that when you're a caregiver in older adulthood, you live less long than people who are not caregivers.
Well, that's demotivating, I guess,
But
to do
yeah,
more
but an
caregiving.
important an important part of that is you have to be really stressed out as a caregiver. So it's really the emotional strain of caregiving that decreases longevity. But the thing is that I really wanted to
Yes.
understand like more about this as a relational process, not just as comparing caregivers to non-caregivers. And this type of emotional dynamics is kind of something that happens within caregiving, and I wanted to explore that more. So that's how I got into it.
Well, because I'm around researchers a lot in some of the work that I do, it's not my focus, but I'm often intrigued by it. And so when I hear something like what you just said, what would strike me would be, are there people who are caregivers that live longer than anybody? And what's unique about them?
Yeah. So there's different research studies that actually show that some caregivers live longer than people who aren't caregivers. And in those studies, it tends to be the case that either there's a selection of who becomes a caregiver, right? So the healthier people are going to be the caregivers compared to people who are less healthy. So it's like a selection effect. If you're healthy enough to be a caregiver, you're going to live longer than other people. The other thing is that if it's not overwhelming in terms of like negative emotions to be a caregiver, and you have a lot of meaning and purpose and self-efficacy as a caregiver, and it's a choice, that's also a thing. So people who don't have a choice as a caregiver have a lot more mental health issues than people who choose to be a caregiver. Um, the meaning and the purpose and still continuing like leisure activities, things they like to do. Actually, those caregivers live longer than people who are not caregivers.
So I guess as you're raising family members and as you're raising your children, for those who have younger children these days, and are hearing this and not really worried about it, but just happen to be tuned in and listening and thinking about it because we're talking about it. How do you cultivate that sense of, I mean, this is actually interesting in the world that I live in of the research around emotional intelligence. There's been a conversation about empathy, and empathy is described typically by a lot of people in the field of psychology as something where you understand how and why people feel the way they do, and how you might be able to be helpful to them in changing those feelings if it seems important to do that. But there's also the emotional empathy, which is actually feeling what somebody feels. And that's different than just intellectually understanding, it's actually feeling it. But then there's a third part, and to me, this is more of a value choice than a skill set. But nevertheless, they talk about it as empathic concern for others. So if I understand how you feel and I feel what you feel, but I don't care about you, what difference does it make? But so this empathic concern for others, it seems to me the most important part of empathy, which is, do I really care about you? Now, sometimes I might care about you because you're only important to me for getting something done. And I care about you from that vantage point. And if I have those other skills, I'll know how to maybe influence you. Some might see it as manipulation. If it's a win for you and a win for me, I see it as influence. If it's just a win for me, then others would see it as manipulation. But the idea is that how can we both have those skills, but mostly how do we raise our children, all of us, to be more concerned about others so that we come to it when something happens to somebody we care about. Purpose is built in. We don't have to recreate it. We care deeply about our families, and as a family member needs us, somehow we carve out time and we don't feel stressed. Well, you obviously feel some stress, but it's not the same as feeling stressed like I don't want to do this. It's like this is who we are. We're a family that cares about each other. We're a family that takes care of each other. Time to take care of you. Someday it might be time to take care of me. If it's always about taking care of you and that's the way it happens, I'm okay with that because it's purpose driven. So I love the idea of you saying it, people that are healthier and do this more come to it with a purpose. It's a mission for them and purpose. But can you cultivate that somehow, do you think?
Yeah, it's interesting you talk about empathic concern and empathy and I've tried to look at this so many different ways as an emotion researcher too, all these different definitions of how you could be thinking about the other person's emotions or feeling that person's emotions and what does it mean in this particular context of caregiving and illness or older adulthood. And it's interesting because a lot of the time, spouses who are very close to one another end up being very like enmeshed with the other person's emotions. And one way I look at this is the inclusion of the other in the self scale. Do you know it by Art Aaron?
Mhm.
And it's just these circles like a Venn diagram, and they get closer and closer and closer. And you can have people, just complete this scale where the circles are completely separated and then they get more and more overlapping. And what I find with spouses who are more overlapping in their inclusion of the other in the self end up being a lot more depressed the worse that their partner is doing. So if they perceive that their partner is really having a lot of negative emotions and they see themselves as like not separated from the other person, they also feel a lot of negative emotions. So
So
there's,
empathy, that feeling of what other people feel, um, it- and that's it's interesting. In the world of emotional intelligence, there are different models of how you define it. One is the stability model that Peter Salovey, Yale's president, and Jack Mayer, his colleague at University of New Hampshire, created with David Crusoe. They created this ability model, and it measures emotional empathy in part. And one of the things that when I first started working with them, late 1990s, I took the test and I thought, great, I'm extremely high on the scale of emotional empathy. But they also measure your ability to manage emotions. So I don't know if you've concluded this in your research at all, but if you look at abilities and you consider the fact that my managing emotions, my internal emotions, was a relatively low score, but I'm feeling what everybody else is feeling. I could easily see myself getting sucked into that. Oh my God, you're feeling awful and I'm feeling awful with you now, as opposed to trying to be helpful and being strong for the other person and my partner. So I think our ability might play a role in this, your ability to manage your emotions, because while you might be heightened in feeling what somebody else is feeling, and that also might be might be interesting from the ability base as well to if you can't feel what other people feel, you intellectually understand it, maybe you're stronger in being helpful because you're more distant from it. That circle that overlaps doesn't overlap quite so much if you don't have that necessary natural or ability to feel what somebody else is feeling. So on the one hand, I was pleased to be really high on this, and then found out, yeah, but sometimes, like if I go to a wake and it's for somebody that shouldn't have died when they died, bad accident, young person, somebody's child, and everybody's feeling extreme sorrow. I'm struggling in that moment, even if I don't know the person that well, because of how everybody else is feeling. So, in my point being that ability might play a role in this, emotional abilities, and that um, as you get sucked in like that, again, one of the things that seems to me, if that's happening, if anybody's listening and that's happening to them, you and I have talked about the emotion roadmap as possibly being helpful in your work. The way I think about that is something reminds us of the fact that you're not doing well, and something triggers that, maybe you've fallen and you fell again today, and all the horrible emotions spike. But that's a narrative for me, that's a trigger. We know that's happening. It's going to happen more often. When it happens, once it happens, what are we saying to ourselves? When the trigger happens, instead of just the emotional response, which is often quite negative, it's still going to be negative, obviously, but can we understand this is just part of what's happening? And it happened again today, and I'm sad and upset about that, but I'm not out of my mind about it. Let me help you out. Is there anything that we need to do with next in terms of doctors or hospitals, or are you okay? Kind of dust ourselves off and know that it happened, but continue with the day and not be consumed by it. because the emotions can consume us around things like this, I think. So how does the emotion roadmap help with the narrative about we know these things are going to happen now? When they do happen, what are we saying to ourselves?
Yeah, that's why I was really interested in your work is the emotion regulation piece, I think, is the thing that we can teach people ahead of time because I don't think we can really feel someone to have or really like teach someone to feel empathic concern versus empathy versus like emotional contagion versus self other overlap. Like it's gonna happen and it's okay. I think what we need to do next is understand what happens for us because, some people feel a little emotionally distant from the person who they're a caregiver to, and that's okay. And I think those people tend not to suffer as much because they're not as invested, or at least not telling themselves that they're invested or having those intrusive thoughts that a lot of people who are just like deeply caring about someone may tend to have. So I think it's about understanding like how you're reacting to something and using the tools that you've developed and other people have developed to just understand what those emotions are and to move on so that you can take care of yourself and you can take care of that other person in the best way possible.
Well, why don't you talk about Whoop? Because that was something you were excited about when we talked earlier, and it seems like a model that you're using and that has been helpful in certain circumstances. And let people know what that's about.
Sure. So I had the pleasure of learning about research by Gabrielle Oettingen at New York University, who developed this model called WOOP, which is called the Wish Outcome Obstacle Plan. And um, I had been doing a lot of research and finding that people who were able to kind of continue doing things they like when they were a caregiver and they were emotionally stressed, like keeping up those leisure activities, staying physically active, doing stuff that made them happy every day, had much better outcomes than people who kind of just were trying to get by every day and not doing things that, made them feel refreshed and, themselves. And I thought, like, there are so many things that are stressors for caregivers that stop you from doing the things you like to do. So, are there tools out there that actually could help you, like, be able to accomplish goals in your life? And they could be any type of goals, just from like taking a walk around the block. Like maybe you're just so overwhelmed as a caregiver that you can't even like feel like you have time for that anymore. And you're so restricted in your role that you're feeling very depressed. So are there like known tools out there that have been tested for many, many years that we could just teach to people maybe on the earlier side of their caregiving journey so they kind of have this ingrained in their like emotional toolbox over time, and as things get, harder and harder, they can just pull it out and say like, here's something I know what to do that I've practiced many, many times. And it kind of feels a little bit second nature, but it's needed at the time. So, this model, the Wish Outcome Obstacle Plan model, is based on over 20 years of experimental research and has been brought out like and disseminated all over the world. There's a website for it, there's an app for it, there's all kinds of videos on YouTube to walk you through it. And it's super quick. And as someone who's in public health, I'm really interested in tools that can just get out to everyone, that you don't have to be like hooked up to a therapist or have all of these special resources around you, that you could just learn something and practice it over time. So Whoop is wish. And the first thing you do is you just sit down and think about something that you want to accomplish. And it has to be something you could actually do. It can't be like, I hope my partner's disease goes away, because no one really has control over that. It could happen, but it's probably not something you can do a whoop on. So say for instance, you had a wish that you just wanted to um, go out with your friends once a month, and maybe your partner needs to have someone to take care of them during that time, and you feel like, oh, I just don't want to put in the effort. It's too much, but I know that that would really make me feel happy. And so you think about the outcome. And this is a really important step because you're visualizing and you're taking a moment to think about how you would feel if you were able to go out with your friends for dinner. So you kind of like think about it in your mind and try to envision like and think about the feelings. But then the next step is to think about the obstacle. And the obstacle has to be something that's actually controllable by you. So, is this what is actually getting in the way of me making this happen? And so sometimes this is really hard for people because I think we are kind of defensive or trying to make excuses for stuff a lot of the time just because it's so hard. Um, and so imagine, the obstacle is really just not wanting to bother your sister who could actually come over for that 2 hours on a Friday night or something like that. And feeling bad, like burdening her, or something like that, because she has like a big family to take care of. Um, and so thinking about, yes, the obstacle is feeling like I don't want to ask for help from my
Right.
sister. So then thinking about the if then plan, so the P of WOOP, is thinking about that obstacle, like I don't want to burden my sister. Um, but I know that she's there for me. She's like told me I could do stuff like this. And so my plan is if I feel like, I'm burdening her, then I'm going to remember that she told me like I could ask her for things. And I am going to call her up and say, is there a date, that you're free for 2 hours? And then I'll call up my friends. So the obstacle part is, I think, sometimes the difficult thing to identify because it can be like a thought, a feeling, or it's just some kind of practical obstacle that people kind of have to be really aware of and how they could overcome it. And the thing about WOOP is it can be applied to anything, so it's very personal. Like I can't tell you what your deepest wish is. Only you know what your deepest wish is. And it could be anything from something small like that to something huge. Like I would love to be able to um, walk Hadrian's Wall path or something like that. And I have little mobility now, and you would take the steps to be able to accomplish that giant goal.
So it could be something like a big trip that you always wanted to take, that you'd plan to take, say with a spouse, and now that person can't go, and you still would like before your life ends to be able to do that trip. But it means going away, and your spouse wants to be supportive, but you find you can't even bring it up to them because you feel selfish when you want to do this, and the person that you were going to do it with that was so much a part of your life because of this circle, that they can't go anymore, and so you kind of just shut it out of your mind because you don't even want to bring it up. I can see how that has a real the obstacles are very real, and again, this is where we talked about the obstacles often have emotional underpinnings, and the idea of how am I feeling about this? How do I want my spouse or partner, whoever it is I'm taking care of, to feel about this? Um, what are they feeling? What would be ideal for us to feel? How do we get there? Is there even a way to get there? So that's where at least the concept of a roadmap might be helpful. But sometimes you just choose not to. I think you just kind of say, well, it would have been nice, but it's not going to happen. And then there's the emotional acceptance piece about this was something we had planned on. This was something we hoped to do. It not going to happen. And then, reconciling in your mind. Yeah, but lots of things did happen. We've had lots of wonderful experiences. Hold on to that. Not everything you want in life turns out the way you exactly hope for. I guess as we're thinking about this, as I'm looking at Whoop, the idea of a wish, an obstacle, an outcome, and then a plan. Is that right?
It's actually the wish, the outcome, and the
Okay.
obstacle and the
Oh,
plan.
the plan. Okay, so it's that way. Okay. What's the outcome, and then what's the obstacles, and then what's the plan around that? Got it. Um, so as people, you study dementia a lot, and I don't want to lose that. So your thoughts about I know a lot of people worry about. I mean, I think it's fairly common to forget things as you age, partly because how much can you remember? The older you are, the more things there are to remember. There's only so much capacity, I guess. Um, so as you think about that, what are some of the lessons that you've learned that you might be able to help people with as they have their early onset problems that they experience, or just some of the terror because you've had it in your family and you forgot a few things today, and people start to just get really nervous. You talked about dealing with anxiety. I know people that are anxious about, worried that, I mean, it's like people whose family, there's been breast cancer. They're constantly worried about possibly getting breast cancer. People whose families have had dementia often are worried about, is that happening to me now? I could remember a few things today. I never remember where my keys are, things like that, that are somewhat common. But how have you found people dealing with that successfully, if at all?
Yeah, and in talking to a lot of clinicians that I work with, one of the things they always say is to understand whether there's different stressors in your life, and how that's affecting your psychological well-being and your sleep and your routine, first of all. So if you're starting to worry about things, kind of checking some of those boxes first, because it's more likely that sleep or stress can be affecting some of those, uh, forgetting more, or those kind of moments where you're a little bit worried about your cognition, and that's super common. The most important thing you can do is to just keep on making sure all of your chronic conditions that you have are being treated, um, like monitoring what medications you're on. Are you taking any new weird supplements that aren't regulated, by any kind of governing body? Um, yeah, really just doing like an inventory about your health and wellness, like first of all, before jumping to any conclusions about like cognitive brain change. But if you are still seeing changes and other people in your family are seeing changes in you, it's good to be open to what other people are observing, because sometimes you can't see what you're doing. Or if you're being forgetful, then that means you probably don't know that you asked someone 3 times whether they had dessert or something like that. So I think it's because it's really scary and it's very stigmatized to have cognitive impairment, um, that people kind of don't want to know sometimes if they're doing those things, or they figure, like there's no cure for Alzheimer's, so what's the point? Like, let me just be oblivious. But the thing is that if you address things in a prevention way, um, things will turn out better over time. Even if we don't have like the best drugs yet to delay things, at least you can get other kind of behavioral supports that are out there, that are just prevention measures. You don't have to say like, oh, I have dementia, and be like accepting of that term even. You could just be saying, let me take advantage of all these different resources that are out there that we do to protect people's brain health over time. Um, I don't know, have you seen the Blue Zone
Yeah.
show on Netflix? You might want to check that out. It's really cool, but it looks at all the different environments in the world, like these small towns or villages where there's a large proportion of people who live to be centenarians and are in very good health. And they look at all the factors of their environments and they kind of see that those happen in all of those different places around the world in very similar ways. One of them is meaning and purpose in life. Like each one of these communities has these like cultural or kind of things about their environment where they have a sense of meaning and purpose in life. Another thing they have is like really healthy eating, whether because they're like locked on an island where they actually can't get processed foods or like don't have access to sugar, but instead eat like honey. um, and then I think another thing is that they do a lot of volunteerism, like so they help people besides themselves a lot. And then another thing too is that like the structure of their environments keeps them physically active, or like in Okinawa, they don't have any furniture in their homes, so they're very adept at getting up from a seated position to a standing position every day throughout their life. And so it gives them like extra balance that, you know, us in our Western culture like wouldn't have because we have like our recliners and things like that. So it's like, it's fascinating. And a lot of people who are interested in dementia and preventing dementia are really getting interested in like these structural factors that can lead to better brain health throughout life.
Well, that's fascinating. Really interesting. A number of things about ways to stay healthy, I guess, where you don't have those environments. Maybe you can recreate some of those things for yourself. I think the key of a sense of purpose is really important. I like the WOOP model that you talked about as a strategy. Hopefully, people that listen to the show regularly have learned more about the emotion roadmap, which for those who aren't regular listeners, basically says anytime you've got something important that you're dealing with that has emotional underpinnings and it's really consequential in your life, that you want to stop and take a moment to reflect on what's actually happening, who's involved, how are people feeling, how do you want to feel yourself and anybody else that might be key to what you're trying to get done. Certainly in caregiving, there's maybe multiple people involved, and you want to think about how everybody's feeling. And I think your idea of having several, proactive discussions about how are we going to manage this, how are we going to relate to this, how do we tap into what we're good at and kind of maximize everybody's strengths. What can we do so nobody's feeling jealous or envious that they don't live close, so they have to do most of this, and so they're mad about that. The person who doesn't live close, can you do something else that you're capable of to help out? Those are all important points about this. Is there anything else you think's really critical that you want to say around this world of caregiving? I know that sometimes one of the things by the way, in your part, you have several podcasts. I watched a couple of them. I know one of the things that another person who was an expert you were talking to um, really has dealt with the system of how do you find care, because individually we can't do all this ourselves, and it's incredibly expensive to put people in nursing homes. Um, but it's also expensive, but sometimes it's a better choice or not to have somebody come into the home. And how do you find somebody and how do you screen for somebody who's going to come into the home? Because obviously you're putting them with a loved one. How do you trust them? How do you screen for that? Any thoughts about that part of it?
Yeah, I would just say from a public health perspective, there are so many caregivers around the world and this country that have very little support and are just not acknowledged in kind of any system that we have, whether it's the community or healthcare. Um, everybody's treated as an individual patient in the healthcare system, unless you're like a mother and a baby. Or in pediatrics, we do this a little bit. Or if someone has some kind of skin infection in a family, sometimes they'll treat the whole family because they don't want it to spread to the other people in the households. Um, but we really don't do that for people in older adulthood. And people's health is so connected, and especially when it's a caregiver and someone with multiple chronic conditions or dementia. And so we really need better systems in place in communities to support that that's happening and to think about everybody's health in that situation and how they're connected. And so we just need more helpful policies and acknowledgement in the system that people do not live in isolation from one another, and we should capitalize on our care and love for one another and families that allows people to do better when they have a chronic condition or illness. So supporting that caregiver who already is making a difference on people's lives to bolster it further and protect that person who may be the patient down the road.
So those are the kind of things that might be helpful to think about. I guess if you do interact with the system, any guidance for how you have those interactions when you are looking for support outside of your own family members and friends, perhaps. I realize a lot of people can't afford any kind of system. And I think that's what you're saying. We're not set up with our public health system necessarily to be supportive. Um, but if you are trying to navigate that system, any thoughts about how you do that?
Yeah. So there's a lot of organizations that are out there that are local. So getting in touch with any senior centers or the Alzheimer's Association is very robust if you're dealing with dementia, any type of dementia. Um, and oftentimes, individual communities will have excellent resources. So it's important to talk to other people and kind of not stay hidden, because a lot of people will kind of not reach out to others, especially when they get a diagnosis of something that's maybe stigmatized, or you just don't want to let other people know. It's really important to reach out and get connected to other people, because there are wonderful resources out there, both for emotional needs and practical needs and financial needs and all these different things. They're just not advertised to us if we're not looking for them. So getting connected to those resources, even if you find one person, usually you'll find other ones too. But I'm working on trying to get it so that more people will have more knowledge about what those resources are in everyday life.
So that's your whoop. That's your
Yeah,
wish.
that's my whoop.
Okay, Joan, anything else that you'd like to say? We're getting close to the end of the show, so I appreciate you being on the show with us. I think you've offered a lot of guidance to what happens to people, how they experience um, both being the caregiver as well as being in need, and some of the things that happen to people over time. I hope that people have gotten some benefit and find some resources, and that you have the ability to influence the systems that you've been researching and learning about, so that they're more helpful, I guess, is probably the key word, and more available and more public with what they do, so more people can access them. I know it's often tragic what happens in families when all of a sudden your life is turned upside down because of a diagnosis of an illness that's progressive, and there's no returning from it. It's only going to get worse over time. Or dementia, as you said, you've researched a bunch. Um, it's a tough experience. We've had that in our lives. I know a lot of people have been touched by that. It's sad when it happens. I think in my mind, again, part of what I've tried to do in terms of helping people and having a purpose in my life, which is to help with making a meaningful, positive difference for people. Having a show like this where an expert comes on and talks about some of the things that she or he or they have learned about how to deal with certain challenging situations that are really emotionally challenging. By the way, just to make a note for people that are listening, I just did several other interviews with people that one was about grieving, healthy grief, and the person that I interviewed about that is Karen Kramer, and she has written a book that again has a framework in it that I think will help people to deal with the grief that comes in just knowing you got the diagnosis, or just watching a loved one or yourself begin to experience some of the things we've been talking about. Um, and then another by Dan Goleman and Carrie Chernis, a book called Optimal, which is how do you be the best possible version of yourself every day, every regular day? Not something that's unique and ephemeral, but something that actually happens that you can help control. And a lot of that ties to being more emotionally intelligent. That's sort of my commentary on this. Any last thoughts you'd like to share about this from your perspective?
Yeah, I would just, remind people that it's not easy, whether you're a person living with dementia. I just talked to someone yesterday who said, there's a lot of time between diagnosis and what you imagine the end is. And so really make use of that time in between and have a meaning and purpose. And it's not going to be easy, but think about how you can live your best day every day, not knowing how it's going to change over time. And I find that really a good inspiration for both people who are living with these challenges and are still able to do such important work and also have quality lives. It's not, always such a sad thing. It's just something that is, that you have to have part of your life. And family members should be there to understand that and also have compassion for themselves along the way, because it's also hard for family members too.
And I love the idea of trying to have a conversation with friends and family members about how do we play to our strengths, and trying to work through this. And also, I think, letting go of the times where we feel like I wish somebody else would do something, because I've heard that a number of times with people that are trying to help a certain family member who's struggling, and some people are doing more than others around this, right? So it's not always easy to address that. Okay, so those are some, I think, some tools to take away. I hope that you are able to be successful, continue to be successful. I imagine as you learn more about this, the anxiety you had about it has lessened. I hope so for you. I think we all come to be anxious about certain topics, and part of what I find that helps with anxiety is to learn more about the topic, to understand more about it, not be afraid to face it and confront it and think about it and study it and actually investigate it and see what you can gain from that. I think helps all of us to be less anxious about things that are obviously things of concern. Much of what we talked about today.
Thanks so much, Chuck.
Well, thank you, and thanks a lot for being on the show. If people want to know more about your work, how would they find out about that, Joan? About some of the research that you've done? Is there a website or any way that they could find your work?
Yeah, all you have to do is type Joan Monin and Yale, and I think I'm the first one. My kids are always excited about that.
Okay,
So
Joan.
it's Monin, is how you spell my last name.
Okay, thanks a lot for being a guest on the show. Appreciate it.
Thank you.
Okay, thanks. Bye bye.
Bye bye.